My name is Erica Schmidt. I'm originally from Sioux Falls, South Dakota. I completed my undergraduate training at South Dakota State University, and then I moved down south and completed my graduate school training at the University of Alabama at Birmingham. And then I completed my internship at the Memphis VA Medical Center, and finally got back a little closer to home here in Omaha and completed my fellowship in clinical neuropsychology at UNMC. I think I first became interested in becoming a doctor after an experience shadowing in the emergency department as a high schooler. And I found that working with patients and their families in times of stress and concern about medical conditions was really rewarding. Well, I had never heard of neuropsychology until a couple years into college. I had found that I really enjoyed my psychology classes on human cognition and behavior. And I really enjoyed a neuroanatomy class that I had where I learned all about the brain. And so when I learned that there was a field that combined those interests, the study of brain and behavior relationships called neuropsychology, I was hooked. And I sought out as many experiences as I could to work with patients in that sort of setting. I realized that it can be very stressful for patients to come in and see a new doctor for the first time in a big medical center. And I think it's very common for people not to know what neuropsychology is. And so that adds another level of stress. And so I just want to put patients at ease when they first sit down with me. I'll explain what the day is going to look like, the things that they'll be doing, and I'll ask them what they hope to get out of the appointment, what they're wondering about, and what I can help them with. And then I'll take a little bit of time to get to know them. Typically, we have an hour to talk with patients about what brings them in, what concerns they have, and get a little background information about what's been going on in their lives. In an academic medical center, you have the opportunity to continuously learn and to practice your skills and grow as a clinician. I think also a benefit is being able to work with a team, a multidisciplinary team where you're constantly learning from other people with perhaps different training backgrounds than yourself, and I think that translates into better patient care in the end.